children, their insatiable curiosity, their implicit trust, their never-ending quest for new experiences. It's these qualities that warm and refresh us as we watch them learn and grow from toddlers through adolescence. It is, unfortunately, these same qualities that make children more likely to fall victim to the leading cause of death in Americans between the ages of 1 and 14, trauma. Accident-induced trauma kills more children in this country than all childhood diseases combined, accounting for 6,000 deaths a year and another 120,000 permanent disabilities. The sad fact is that many of these deaths and disabilities, as many as 25%, can be prevented or drastically reduced with prompt and proper care. Saving these lives, lessening and preventing the disabilities, and educating children and adults alike to safeguard against injury is the work of the Kiwanis Pediatric Trauma Center at North Shore University Hospital in Manhasset. Fortunately, most childhood injuries are not that serious and can be treated at the local hospital emergency room. But 1 in 6 of these injuries has the potential to be fatal or cause long-term disability. For these pint-sized patients, a properly equipped and staffed facility that specializes in pediatric trauma can truly make the difference. Pediatric patients are more than just little people. Their parts are smaller. Their proportions are different. Their internal systems and chemical relationships function differently than those of adults. That means every tier of the emergency care system, from the paramedic through the physical therapist, needs specialized training, skill sets, and equipment to pull these seriously injured children through the resuscitation, stabilization, treatment, and rehabilitation processes. The Kiwanis Pediatric Trauma Center draws from the vast resources of the hospital as a regional trauma center to provide all of these special resources to increase the chances of survival and ensure the best possible outcome for pediatric trauma victims. Medevac helicopters and local advanced life support ambulances can transport pediatric patients directly from the accident scene or from other hospital emergency rooms in minutes. Resuscitation and stabilization efforts are continued while en route to the pediatric emergency room. Upon arrival, pediatric trauma specialists take over the life-saving treatment. Radiologists and surgeons are at the hospital around the clock to provide critical diagnosis and can even perform life-saving surgery in the specially equipped trauma room if necessary. Pediatric nurses, internists, and physicians experienced in the management of seriously injured or ill children provide moment-to-moment care in a section of the emergency room designed and equipped to deal only with pediatric patients. Once these seriously injured patients are stabilized, they are transferred to the 15-bed pediatric intensive care unit, where they receive extra medical attention and specialized monitoring. The hospital's 50 full-time pediatric subspecialists and 200 pediatric specialists with staff privileges are also available if needed. For extended stays, the Child Life program offers continuing support, including half-day school and recreation therapy. Physical therapists and social workers provide both in-hospital and outpatient follow-up care. Quality pediatric trauma care starts long before the child arrives in the emergency room. The Kiwanis Pediatric Trauma Center and North Shore University Hospital conduct extensive professional training and continuing education programs for doctors, nurses, emergency room personnel, and community-based emergency medical technicians. The Hospital Center for Emergency Training and Development is a state-certified institution that not only teaches pediatric skills to pre-hospital providers, they also teach the instructors of those providers. The Trauma Center staff extends their knowledge base by maintaining a hotline that links their critical care experts to surrounding area hospitals, seeking consultation, or wishing to make arrangements to transfer critically ill patients in need of specialized treatment. And because we can heal, but would much rather prevent injury, the North Shore Long Island Jewish Health System's Department of Professional and Public Health Education has designed a series of educational programs for the parents, teachers, babysitters, coaches, and others who care for our children on a daily basis. The Kiwanis clubs in this region support this vital facility both financially and administratively, raising the dollars that allow the funding of research, education, equipment, and staffing of this specialized facility. They also provide the manpower for support services, like babysitting and transportation for parents with recovering children. It's local Kiwanis clubs that supply area ambulance and rescue squads with pediatric trauma kits. These kits provide their EMTs with the equipment they need to resuscitate, evaluate, and stabilize their pediatric patients. Children are our most precious asset. Most will never need more than love, education, and a nurturing environment to grow to healthy adults living normal lives. But many of our small citizens, as many as 125,000 a year, will fall victim to accidents and be seriously injured as a result. The Kiwanis Pediatric Trauma Center is dedicated to reducing the number of deaths and disabilities caused by these accidents. With your help, we can make it happen.